So, how does a woman know she's pregnant before she decides, okay, I need a pregnancy test? Because, as you mentioned, if the implantation happens and there's some bleeding, which might be mistaken for a period, then what are some of the symptoms that a woman might develop that might cause her to think, maybe I'm pregnant? Maybe I should take a pregnancy test?
Well, we always talk about the common symptoms and the ones that everybody sort of reads about and hears about. For one thing, the patient's breasts may feel a little bit more full. Certainly, the missed menstrual cycle is a clue. Remember, implantation bleeding occurs in some patients, but not in all patients. So, if a patient has missed her menstrual cycle, or the menstrual cycle or the menstrual flow is not quite the way it usually is, it's a lot lighter, maybe a little spotting, and a patient may feel the urge to urinate a little bit more frequently, feels a little bit more fuller, a little bit more bloated. And sometimes, and not always, patients begin to develop a little queasiness, the so-called morning sickness. That usually occurs a little bit later on, but all of these things, in general, patients will feel a little bit different. They'll feel more fullness in their chest as the most common symptom. And that's a time that says, hey, something is off. Maybe I should look at, doing a pregnancy test or finding out whether I am indeed pregnant. And of course, if the patient is trying to get pregnant, that would be a good source of suspicion.